Ask the Doctor with Michael Lange begins in 2 minutes. Ask the Doctor with Michael Lange begins in 60 seconds. Ask the Doctor with Michael Lange begins in 30 seconds. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Alrighty, good morning and welcome to Ask the Doctor. I'm your host, Dr. Michael P. Lange of the Lange Eye Institute and Fortifeye Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. Remember, you can pick me up again after this hour on certain Salem media Faith Talk stations, especially here in the Tampa Bay area. So after this hour, so we're on 9 to 10 here in Tampa Bay, 8 to 9, I think, in Little Rock, Arkansas area. So we're coast to coast. But you can pick me up on 570 AM, 910 AM, 100.3 FM, and 102.1 FM after this hour. So if you can't catch everything, or you tune in a little bit later, or you want to tune in later because you got something to do, then after this hour, tune into those 4 stations right here in the Tampa Bay area. Also, we're broadcasting on a variety of other radio stations throughout the great state of Florida and throughout the country, and certainly live video streaming all over the world. You can learn more at drmichaellange.com, simply drmichaellange.com. And if you want to learn a lot more about nutrition, about the supplements that we've developed at Fortifeye Vitamins that are evidence-based nutraceuticals based on the latest clinical science, go to fortifeye.com. That's Fortifeye, fortifeye.com. One more time, fortifeye.com. Remember, an eye doctor, so that's why the EYE is in Fortifeye. It's kind of a play on words. All right, phone lines are open, 1-877-969-8600. Toll free anywhere in the continental U.S., 1-877-969-8600. If you're watching live video streaming, I got my 4th of July hat on, and I got about 3 different 4th of July hats. So it's really official hat day for the 4th of July today. And I want to welcome Doc Hall my co-host, Doc Hall. Good morning. How you doing?
Good morning, my good friend and colleague. How you doing today?
Fabulous.
I knew you would be. Happy, safe 4th of July to you and to all of our listeners out there. We're glad that you tuned in with us today. We appreciate you, and we're glad you're here. We're watching here in Florida. We're watching a storm building down in around Cuba, and it's at hurricane status, and so we're kind of keeping an eye on that this weekend. And folks, just remember to prepare in advance for storms like this. And flashlights, batteries, prescriptions, you know the drill, but get it done. And like I always say, prepare for the worst and hope for the best. And we have lots of news and announcements this week from our lab. Dr. Lange and I have been in the lab every day this week working on some new formulas for your good health. And I like to make this announcement too, that we broke it loose last week, but our new 60 serving protein isolate is now on the shelves. Folks, this is 60 servings for less than $60. Fantastic price and even better, fantastic quality for you. As we always say, we're very proud of what goes into our product, just as proud as what doesn't go into our product. I just want to do a quick shout out to my mom out there. Her birthday is this next week, and mine is this next week too. And so we're going to be celebrating together. And happy birthday, Mom. We made another one. And we have some sales going on this week, and we'll be announcing those through the show. So back to you, Dr. Lange, and our first call of the day. And I bet I know who that is.
Thanks, Doc. And certainly anybody out there listening, give us a call. Anything regarding your vision, eye care, or nutritionally related topic, 1-877-969-8600. Before we take the next call or the first call, I just want to reiterate the new whey protein isolate. It's the same whey protein isolate we've had. It's just we put it in a bag that's 60 servings for $59.99. It's been selling like hotcakes at our nutrition center in Ocala, the Lange Nutrition Center Ocala, the Fortifeye Nutrition Center in Clearwater, which, by the way, I'll be there after the show today from about 11:30 to 1:30. And even at the Lange Eye Institute, we sold a lot of bags of this because it's a really good deal. Remember, a non-denatured grass-fed American cow whey protein isolate is one of the best ways to build muscle, endurance, stimulate your immune system, making a great smoothie, put it in your pancakes or your waffles or even in your cookies. It's a great way for your kids to get more protein, your mom, your grandparents to get more protein. It's a great way to help you from a nutritional standpoint, nutritionally support your body. So check it out at fortifeye.com. Go to Grass Fed Whey Isolate. You can buy them at a case. You can buy a case, 6, or you can buy them 20 servings, or you can buy the bags that have 60 servings. All right. Before one more thing I'm going to mention here, because we always give a great deal on each show. I'm holding up in front of us something that's very popular. It's a company I started years ago called Paleo Simplified, and this is called Praline Crunch. I designed this, developed it, taste tested, and everything. Worked on it with a New Orleans chef, and it's delicious. It is good for you. It is healthy, non-GMO. It is an oat-free, gluten-free superfood crunch. Praline Crunch. You can put milk on it or coconut milk on it or whatever, and have it for cereal. You can have it as a healthy snack instead of the potato chips. But we got a deal on this now at the website, fortifeye.com, or any of the other places you can pick it up. If you buy one bag at a time, it's $5 a bag. It used to be $7.50. If you went to Whole Foods or Fresh Market when we were selling them there, they were $7.50, even $8 a bag. So you buy 3, that's $15. You get 1 free. So basically, you're getting 4 for $15. I mean, that's $3.75 a bag. I mean, that's basically our cost. It's called Paleo Simplified Praline Crunch. Your kids will love it. Everybody will love it. Check it out. With that, we're going to go to the first caller of the morning. We missed him last week. Bob, good morning. Welcome to the program.
Good morning, doctors. It's a pleasure to talk to you this morning. The mothership was in the neighborhood again last week. I just couldn't maintain radio contact last week, so I bailed out. But this week, Happy 4th of July to both of you doctors, and Dr. Hall, happy birthday. And to Mom,
Thank you.
too.
Appreciate that. Thank you.
Doctors, this morning I've had a thought, and I have discussed it briefly with Dr. Hall. My son-in-law has some upper respiratory problems, specifically a touch of asthma, and he contracted COVID and caused him and the family a great deal of angst during that time. But the remedy, apart from the battery of vitamins that they told him to take, they put him on a steroid, which happens to be the same steroid that my wife takes when she's hospitalized for her MS. Now, I know normally we don't try to treat the symptoms, but we try to treat the cause. And in both of these cases, my son-in-law's asthma is as a result of congenital birth defect, and then my wife's MS is a non-curable ailment, so they tell me. So now we're just treating the symptoms, which are similar as far as weakness and just losing strength during the course of the day. So, am I correct in my desire to get my wife to go on the same protocol that my son-in-law is on in order to try to increase his strength during the course of the day?
Well, that's going to be up to her physician to determine whether or not something like cortisone or prednisone is going to be beneficial for her. You know, Bob, prednisone, I'm a big advocate of the least amount of medication that gets the job done, okay? But prednisone can be life-saving. Steroids can be life-saving. It can help you be mobile, help you to breathe so you don't die. You know, rheumatoid arthritis, it can help them, like I said, to be mobile. There's patients that develop things called giant cell arteritis where you can go blind from it. So steroids, and a competent physician prescribing the right amount for the right period of time is an amazing drug. It's a godsend, and it is beneficial, and many people do need it. And will it help your wife? I mean, that's a good question. I think you need to consult with her physician about it. I mean, if she's got inflammation, and she very well possibly does, it could help her. Now, you got to remember that corticosteroids are not without inherent risks. And so anytime you're on steroids, you got to see your optometrist or your ophthalmologist, optometric physician, have the pressure checked in your eye, because there's steroid responders out there where the pressure can go way up and induce glaucoma. But also you got to monitor your blood sugar. You got to monitor your blood pressure, because it can cause, you know, blood sugar and diabetes and blood pressure and Cushing syndrome. There's a whole host of things it can cause. It can actually help your immune system. By the same token, it can compromise your immune system. So it's not something you just willy-nilly get prescribed just by your primary care physician unless they really are in tune with it. So, you know, his asthmatic doctor, his pulmonologist, his allergist for your son-in-law needs to be monitoring him very carefully. But from an eye standpoint, he needs to have an eye exam while he's on these steroids, unequivocally, without a shadow of a doubt. I mean, it's worth a shot talking to your wife's physician about it, Bob, because as you know, you're trying to do anything and everything it can help to preserve her health and improve her quality of life.
Well, doctor, that's pretty much my desire. It has been for quite some time, and my wife really resists taking the prednisone because when she does have some blood work done, it does give her an indication of being pre-diabetic. Now, the neurologist has prescribed a 5 or 10 milligram dosage that we just have in the house, so that when she falls off the edge of the cliff,
right,
that rather than calling the ambulance to take her to the hospital, we can. I don't like using the word self-medicate, but use a minimal dose prednisone for 5 days and then be done with it.
Yeah, I think that's totally wise, as long as your physician said it's okay to do that, because like I said, these drugs can be very, very beneficial. I know there's a lot of talk shows out there where they condemn medications, but that's crazy. Certain medications are beneficial and will help prolong your life and improve your quality of life. So, just talk and consult with a physician. And certainly Doc Hall is a wealth of knowledge from the whole nutritional side, and me with the eye and the nutritional side. So you got a good team in your corner. Just utilize it like you have been, and of course, nothing wrong with praying to the good man upstairs as well.
Well, all of those things are a constant part of one's daily life nowadays, doctors.
Amen.
Happy birthday, United States, and Doc Hall. Have a good week, gentlemen. Lord willing, we'll talk to you next week.
Hang in there, Bob. Thank you.
Thank you, Bob.
And happy birthday to Doc Hall's mom, if she's listening. Happy birthday. You got a great son there. I got to say that over there, right?
Absolutely. I wouldn't expect anything less from you.
And let's have some phone calls. We still want a call from the Little Rock, Arkansas area. We get tons of calls from all over the country, but we're still waiting to see if we're coming in loud and clear in Little Rock. I don't know how strong that radio station is there, but it's 1-877-969-8600, 1-877-969-8600. Give us a call. Any topic regarding nutrition, your eyes, sports nutrition. Doc Hall is a guru, an icon in the sports nutrition industry, in the bodybuilding industry, the powerlifting industry, the anti-aging industry. So he's always a great asset to have on the show with me. And of course, you get me. Who better to talk to? It's all free consultations. And this is for educational purposes only, in case my attorneys are listening. This never replaces a comprehensive medical evaluation or an eye examination. If you haven't seen your eye doctor lately, it's a good idea to get an eye exam. Remember, a routine eye exam may not only be vision-saving, it could be life-saving. So certainly, when the optometrist or optometric physician, ophthalmologist looks in your eyes, they're looking for the first signs of eye diseases like glaucoma, which, by the way, is the sneak thief of your sight because you have no symptoms until it's too late. We're looking for the first signs of macular degeneration, retinal holes and tears that could lead to retinal detachments, cataracts, all this, and checking your refractive error to make sure you need or you don't need glasses or contact lenses or LASIK surgery. But maybe just more importantly than that even is some of the first telltale signs of systemic diseases show up in the eye. High blood pressure, diabetes, pending strokes, brain tumors, even sexually transmitted diseases oftentimes show up in the eye. Collagen vascular diseases, immune compromised diseases, things like sarcoid and lupus, and actually fibromyalgia, rheumatoid arthritis, Graves' disease, thyroid problems. All of this can show up on a routine eye exam. So if you get anything from this show today, get in, have your eyes dilated, see one of your local eye care providers. I'm a little bit biased. I say go see an optometrist or an optometric physician for your primary eye care needs. Then they can make a referral to a fellowship-trained ophthalmologist for your cataract surgery, retinal surgery, or whatever you need, any type of surgical intervention. Now, Doc Hall, we talk a lot about everything on this program, but it is hot out there right now. And I see lots of patients that come in with dry eye, really dry eye. And when we talk to them, they have other symptoms. They're fatigued. They have heart palpitations. They have confusion. They have dizzy spells. Oftentimes they go to the emergency room. And, sometimes it's simply they're dehydrated. They're not drinking enough water. They think they have to be thirsty to drink water. But I see it all the time. It helps their dry eye drinking more water. If you're out playing a lot of sports and dehydrated, you need to drink something that replenishes your electrolytes too. If you're into the natural aspects, instead of something like Gatorade or Quick Kick or any of these liquid IV, you can always go coconut water, organic coconut water, but you got to add a little pink Himalayan sea salt, add a little salt to it to add some sodium. And then that's the perfect post-recovery, out there sweating type of drink to combat against dehydration. Coconut water has natural electrolytes, potassium. It has a little sodium, magnesium, manganese. Believe it or not, it has amino acids in it too. But just add a little salt and you're good to go. Dehydration is a big problem right now, isn't it, Doc?
Absolutely, especially across the country right now. Received a lot of calls in the last 2 or 3 weeks. Some of those temperatures out west, I mean, 122 degrees,
Yes.
and that's just incredible, you know. And people are out. There was a guy the other day that he was out sunbathing, and he passed away because he was out sunbathing. We have to use common sense here with a lot of this stuff. And as you said, the easiest is to hydrate the body. You know, there's some really good things out there um, um, as far as hydration goes, but the most simplest is water.
Right.
That's all. And you know, you can flavor it up. You can put cucumber and lemon in there, and like that. I'll tell you, folks. I know it's July 4th weekend. How many of you have a watermelon sitting around right now? Most everybody does. And watermelon is one of the best hydration liquids out there. And you can mix that up. I do it all the time with our Fit formula. And for post workout, I put a little watermelon in the blender and I put some strawberries in there. And I use the strawberry watermelon Fit. And it's excellent. It's fantastic. After I mow the lawn or outside doing activity and like that, I drink a glass of watermelon juice, and all it is just blended up watermelon, and it's great. It hydrates the system. It tastes great. It has that sweetness to it, and so it's good. You know, the thing is once you receive or understand that. You're thirsty and you say, gee, I'm thirsty, I better drink some water. It's kind of, I want to say it's too late because it's never too late. But, you know, you should be drinking water throughout the day, not just at certain times or when your body says, wow, you know, my mouth is dry and my sinuses are dry and like, better drink some water. No, you should have already done that. And so it's very simple, folks. Just hydrate, and we'll get through all this together. And it's very simple. Back to you, Dr. Lang.
Yep. And as a rule of thumb, I always preach, you know, drink half your body weight in ounces of water. If you weigh 200 pounds, drinking out 100 ounces of water a day. Obviously, if you're having diarrhea, or you're vomiting, you're sick, you're exercising a lot, you got to drink more than that. But watermelon, I love too, Doc. I mean, watermelon's high in vitamins, very high in vitamin C, very high in something called L-citrulline that converts to L-arginine that converts to nitrous oxide, which is great for people for building muscle and for lowering blood pressure. And believe it or not, helping people with erectile dysfunction even, okay? And there's people out there with it. Yeah, there's a lot of people out there with that. So, you know, watermelon is kind of a power food, okay? And we use that with our whey protein. Like you said, with the Fit, the Fortifeye Fit, you combine that with strawberries, post-recovery, and even pre-workout. But you can simply take, before we developed Fortifeye Fit, one of the best post-recovery drinks after working out was, believe it or not, chocolate milk, but get A2 chocolate milk or Promised Land chocolate milk because that has the good A2 beta casein protein. It doesn't have the genetic mutation of the A1 beta casein that is affiliated with leaky gut, diabetes, cancer, and autism. So A2 chocolate milk, all right, or goat's chocolate milk, and some watermelon with the whey protein isolate or our super protein, either one of them, our naked protein or our new grass-fed 60 serving, and you blend it together really quickly. In a perfect world now, this is how you do it. You take the chocolate milk and you blend it for a few seconds. Then you add the protein and just blend it for a second or two. So put your protein in last because the whey proteins are very delicate, and if you blend them for a long period of time, it can actually denature the protein. So if you're putting blueberries and strawberries and bananas in and with some coconut milk, blend it, then add the protein, then just for about 2 seconds, and you're good to go. So phone lines are open, 1-877-969-8600. We're broadcasting from the Sky 97.3 FM up in the Gainesville, Ocala, Lake City Villages area, 1-877-969-8600. 860 AM, that's Salem Media here with their FM affiliate, also 9:30 AM, 8:20 AM here in Tampa Bay. That's a mega station. It's all over the state of Florida and a variety of other stations. Once again, give us a call. Consultation is free. Doc Hall and myself, Dr. Michael Lang, 1-877-969-8600. Now I'm going to give you the phone number for Fortifeye Vitamins, and I'm going to give you the website one more time. if you look at all the supplements that we've developed on the Fortifeye website, beneath it has all the evidence-based science, why we use specific nutrients and what levels, okay? So that's fortifeye.com, Fortifeye, fortifeye.com, toll-free number 866-503-9746. One more time, 866-503-9746. Arlene's probably there now answering the phones. If not, she'll be there very soon. And remember, I'll be at the Fortifeye Nutrition Center in Clearwater, right on McMullen Booth Road. It's about a mile off of from the Causeway on the left-hand side in Publix Plaza. I'll be there about 11:30 today, an hour or two. Doc Hall is Monday through Friday at the Lange Nutrition Center in Ocala, right there on State Road 200. Only two-story building on State Road 200, directly across the street from the mall. Just take the elevator up, first door on the right. You'll see Doc Hall. You can set up an appointment for a free nutritional consultation. But he's got just about every vitamin known to man there that you need to support anti-aging in your body and to build muscle and lose fat. Doc, you're there. What time do you get there in the morning?
Oh, I'm there Monday through Friday, 9 to 5. And I want to pass on a direct line number. About 3 months ago, I put in a direct line that comes right to my desk. No one else answers my phones. I do my own phone work. And so this direct line is 352-353-2206. Again, 352-353-2206. And I'm there 9 to 5, Monday through Friday. Give me a call. If you have a question, you have a concern, you want to know about how much of this to take, how much of that, give me a call. It's free. And you can call me anytime and be glad to help you. Two quick things, Dr. Lange. Optase, your number one choice for dry eye drops. We have those back in all three offices now, and I have a good supply. So we ran low a little bit just because of our radio talk about Optase. And it's excellent. And I've been a Oasis fan for years, as have you, and we still are. We love Oasis. I use Oasis Tears Plus, and but I tried Optase, and I like it too. It's a real comprehensive formula, and that's back on the shelves. One other little housekeeping thing here. As you know, and as we always say, you know, we're a global family at Fortifeye Nutrition and Lange Nutrition. We try to be, and we have listeners from around the world. A few weeks ago, one of our listeners, Honey from Hollandale, called up. She had some concerns about a cataract surgery that was coming up and a little bit of anxiety in there. And people have been calling, hey, how's Honey? We haven't heard from her or what happened and like that. I'm here to report she did have her surgery. It came out very well. Her sight is right at the top, and she's very happy, and that anxiety is gone. And so we wish you well from Dr. Lange and I, Honey. We wish you well, and keep up the progress. You're doing great. And so that's it from me. I just want to get those last two couple things in there.
Awesome. Yes, the Optase is an amazing lubricant. You can get it on the Fortifeye website. You can get it through your local eye doctor. Optase is amazing. Also, the Upneek. That's an eye drop you can put in your eye. 20 minutes later, your eyes go up about 25 to 35%. If you have ptosis, baggy eyelids, ask your local eye care provider, come to the Lange Eye Institute and try the Upneek. Amazing product. All right, we're going to the phones. We got a bunch of people holding. We got a few different Steves on hold. Let's go to Steve in Clearwater first. Good morning. Welcome to the program.
Yeah, real quick, I heard something on TV, which I'm trying to get the source of now, about the people who are taking zinc for COVID. You know, they give them quite a bit. They give them like you need 100 milligrams or more. And then you got to remember they're doing it day after day after day after day. What they have found in Greece, I believe they said, some people who are getting hypocuprimia, low copper, because of that. But what they're finding is that the people who get it the worst are the people who are taking the vitamin C with the zinc. Because you know how vitamin C increases iron absorption? It takes the ferric ions and makes them ferrous ions.
Right.
Okay, that vitamin C helps iron absorption. but it does just the opposite with copper. It takes it from cupric to cuprous, or the other way around, I forgot. And so what happens is when you're taking the vitamin C, which decreases its absorption, and then you're taking the zinc, which further antagonizes it farther down the chain, they're finding some cases, at least in Greece, they found some cases. So now they're giving, I think it's 4 milligrams of copper. Sounds like a lot, but remember, they're correcting a deficiency for that. But it's a very rare thing, but they have found it to be happening. So
right. I think, Steve, that most of the latest nutritional science says as long as you take 40 milligrams of zinc or less a day, you don't need copper.
Right.
But then anything above that, as a rule of thumb, so if you're taking 50, you need 1 milligram of copper. 80, you need 2. You probably every 40 milligrams, you add 1 milligram of copper. That's about what most science is looking at, because yes, that's true. Zinc will deplete your copper and cause a problem. But by the same token, if you take too much copper, you get copper toxicity that's very, very damaging to your body as well. And there's a lot of companies out there that are only giving you 10 grams of zinc and 10 milligrams of zinc, but yet there's 2 milligrams of copper. And, so it's boiling down to an exact science. And that's why, we try to stay abreast of the latest changes and incorporate that. We don't have any copper in our supplements, but the most zinc that we have is only 40 milligrams, and most of them have less than that.
Right.
But you bring up a valid point. I'm glad you brought that up.
Yeah, I was going to ask Dr. Hall. You say all medicines have side effects, and some medicines we think is bad. Like you were talking about the plus and minuses of prednisone. If you take anabolic steroids, okay, which everybody says, oh, they're so bad and they make you crazy and they give you heart problems and all that. What about if you took elderly people who hadn't exercised for 20 years, and you put them on would it really hurt them to have maybe 2 weeks of anabolic steroids to kind of boot up their muscular system to help them with starting the exercise program, then get them off of it as soon as possible?
Well, Steve, you bring up a good point there. And I guess it was about 2 months ago, I read some research just on that. They're actually doing studies on that. There's no findings yet or anything, but I think there's 3, maybe 4 universities right now doing studies just on that. And because I've been involved in bodybuilding for, my goodness, 40 years, and I've seen the abuse of steroids, certainly, and I've seen bodybuilders absolutely die and compromise their wellness because of overuse and abuse. And but within measured doses, and that's what they're looking at right now. There seems to be, some validity to what you're saying, and we'll have to see, what research plays out. But I get your point, and believe me, you're right on the mark with it. There is research being done just in that area.
Yep.
Oh, that'll be cool. Okay, well, you guys have a great 4th of July.
All right, Steve, take care. 4th of July to yourself. All right, listening to Ask the Doctor is Doc Hall and Dr. Lange, 1-877-969-8600, 1-877-969-8600. And once again, any of these bodybuilders and powerlifters and pro athletes listening, don't willy-nilly take your anabolic steroids and buy it from the guy, the black bag in the back of the gym and the back of the Walmart parking lot. All right, go ahead and let your physician know that you're taking these anabolic steroids, and let them do the appropriate blood tests and things to make sure that you're not, ODing on it. There's a lot of you guys out there listening to the show that are taking Dianabol and Winstrol, Decadurabolin, Anavar, and you're taking all of these, not to mention testosterone and human growth hormone. And more is not better. I mean, it can develop all sorts of horrendous ocular problems, but other problems as well. So like Doc Hall said, the right amount under medical supervision. But work out, eat well, take something like our Fortifeye Fit and our Fortifeye Protein. You don't need to be using these drugs. Now, like Steve brought up, if you're getting a lot older and you want to increase your quality of life, maybe these things can be beneficial. All right, let's go to the phones. We have Eleanor in Summerfield. Eleanor, thanks for holding, and good morning.
Good morning, and thanks for taking my call. I was just prescribed Restasis for dry eye, very dry eye. I had cataract surgery, and then a few months later, I had to have the laser. and of course, I have a dry eye before. Now, on the Restasis, I started it like yesterday. How long before I have to take it once in the morning and once at night? 1 drop in each eye. How long before I would see any results?
It's going to take a while. Now, this has a lubricant made by Allergan that's the vehicle for it to actually the delivery system called Refresh Endura. And that works fairly quickly because it's just like an artificial tear. So that'll help you dry very quickly. But the actual topical cyclosporin, the drug that's in the Restasis, really, I mean, they'll tell you a month to 2 months to fully kick in. I've seen patients benefit in 2 weeks, and I've seen it take as long as 2 months. So you have to be on it for 2 to 3 months before you make up your mind that you're not going to take it anymore, okay? And you can only use it twice a day. And if you're going to use something in between, the one I recommend is the Optase that we were just talking about. You can use that as much as you want in between the Restasis. Now, also, remember, good lid hygiene is very important for dry eye. A hot compress or something like the Bruder mask a couple of times a day for 10 minutes. Make sure your eyelashes are very clean. Cleaning them, I like hypochlor solution the best because it kills everything on the eyelids. So we clean them, we heat them, we lubricate, and we nutrify. A good omega-3 fish oil is crucial. Black currant seed oil that has GLA is also very good, and astaxanthin is good. You can take those singly, or I developed, if you listen to this program, something called Fortifeye Advanced Dry Eye Therapy. We take all of those nutrients and put it in a box and discount it at a pretty good price. So that's something to think about. You can look at it up on the website at fortifeye.com, do the research, read the articles we've written on Fortifeye Advanced Dry Eye Therapy. So remember, dry eye can be a horrendous problem. And so at least you're going in the right direction. You're trying to do something to help. But I think it's a combination of not only the Restasis, but the other things that I mentioned, and it's going to nip this in the butt, so to speak.
What was that vitamin? Advanced?
Oh, it's called Fortifeye, Fortifeye, Fortifeye Advanced Dry Eye Therapy.
Dry eye therapy.
Right.
Yeah, I'll get that.
And that's also beneficial for your joints, your skin, your vascular system, just inflammation in your body. It supports an anti-inflammatory process in your eye, and that's why it helps you to produce a healthier tear film. And it works quite well. We've got thousands of patients on it, doctors all over the world recommending it. So it's worth a try, and it's a natural approach, okay?
Yes, thank you. God bless you. Keep up the good work.
All right. You take care, Eleanor. Bye-bye. All right. You're listening to Ask the Doctors, Dr. Richard Hall, and myself, Dr. Michael P. Lange, P for Paul. Give us a holler at 1-877-969-8600. I'll give you the phone number for Fortifeye Vitamins. Arlene is in the house right now answering the phones. The phone number for Fortifeye Vitamins is 866-503-9746. That's 866-503-9746. And the website, you can order toll-free shipping. We got to compete against Amazon, right? So free shipping, not toll-free shipping. Free shipping. And that's fortifeye.com, Fortifeye, fortifeye.com. Check out the bundle deals that we have under bundles. That's why we bundle a lot of things that work synergistically together at helping your overall health, helping support your body from a nutritional standpoint. All right, we're going to Daniel in Kenneth City. Daniel, good morning.
Good morning, Dr. Lange and Dr. Hall, and a big shout out to Arlene, too. I had the pleasure of meeting you a couple of weeks ago, and I'm a helicopter pilot, and I got a question on, right now I'm wearing progressive lenses, and I was wondering if it might be worth it, because the FAA will allow progressive lenses, and they'll also allow those multifocal contact lenses.
Right.
And I'm just wondering if maybe I ought to stick with the progressives as opposed to the multifocals, or whether there's a benefit for those multifocals.
All right. So your question is, should I go to the multifocal contacts or stay in the progressive lenses via glasses, right?
Yes, sir. That's correct.
All right. I don't want to sound negative about contacts, but if I were you, I would stay in the progressive lenses via the glasses, because you're flying a helicopter. You need to see your gauges. You need to be able to know what's going on. The problem with a multifocal contact lens is you're going to get fluctuation in vision. Sometimes clear, sometimes blurry, all right? Sometimes you feel like a nut. Sometimes you don't. Remember that commercial?
Yep.
So I would not want you to be in a predicament when you're flying that helicopter where you can't see your gauges and the important gauges you need. So multifocal contacts, some of them work amazing on some patients and some of them don't. What you could do, if you really want to try it, get into your local optometrist, come see me in the Lange Eye Institute and have them fit you in it, give you some free trial pair, try them to see if you're getting this fluctuation. But when you're in a helicopter, that's kind of a dry environment as well. Any type of, when you're flying, you're concentrating, you're not blinking. When the contact dries out, you're going to have terrible optics. And I don't think if you're in a race car, if you're flying a helicopter, you're flying a jet, anything like that, you want to have good vision.
I agree, and I think just stick with the progressives that I got for the time being. And once the season's over, if I get a chance, I will make an appointment with you guys.
Absolutely.
All right, thank you, Dr. Lange. Appreciate it.
All right, Daniel. All right, we're on a roll, Doc. All phone numbers are 1-877-969-8600. Still waiting for a Little Rock caller. Come on, Little Rock, Arkansas. Shout out, give us a hello. 1-877-969-8600. Let's go to Marianne in Largo.
Hi, good morning.
Morning.
What I'm calling about is I had added zinc 30 milligrams during this COVID time, and I took it for some time, and then I realized that I've been taking Mineral 650 by Pure Encapsulations, and I take 6 of those a day. And it says that the serving size is 3 capsules, and when I look at the zinc amount, it's 12.5 milligrams per serving. So I figure, I guess, through the day I'm getting 25 milligrams of zinc that way.
Right.
So I stopped taking the 30 milligrams. What do you recommend?
Yeah, I think that was a good idea. I really do, because the whole copper issue, because if you're taking as much as you were, you needed to be getting a little copper. But maybe the Pure Encapsulation had a little copper in with it. Do you know?
It does not, because I had been taking for years the one without copper and iron.
Right. Yeah, I think that was a wise move. I think, remember, that's a rule of thumb, and this isn't in stone anywhere, but this is what most nutritional gurus would recommend. 40 milligrams of zinc and below, no zinc. 40 milligrams and above, no copper. 40 milligrams and above, you got to add copper. So 1 milligram of copper for every 40 milligrams. So if you're taking 80, you need 2 milligrams of copper. So I usually say just stay at 40 milligrams or below, and that way you're staying safe unless your doctor recommends, more.
Okay, I guess my wonderment is the 25 milligrams scattered through the day enough to, protect from the COVID, which, the zinc they're saying is a good thing.
Well, zinc is good for your immune system. It really is. And so I think zinc is very important. But remember, a lot of us are getting plenty of zinc in the diet. If you're eating any red meat, if you're eating protein, animal protein, you're not a complete vegan, then you're probably not zinc deficient to begin with. So as a rule of thumb, my advice is 40 milligrams of zinc or less, no more than that, unless prescribed by your doctor, okay?
Okay, yeah, that was just my wondering if I was getting enough zinc to protect me from the virus.
That's a good question. I don't know if nobody knows that answer 100%. Like I said,
right.
just boost your immune system and have positive thoughts, and life will be good.
Thank you.
All right, bye-bye.
Dr. Lange?
Yes, sir.
Just one quick thing on that, too. On the zinc and a lot of the other ingredients out there on the vitamins that folks are taking, I see it every week. When I do a consultation, I have folks bring in all their vitamins to me so I can see them. And again, this last week it happened. I had a lady taking zinc from 11 different bottles. And we just don't realize that. She had one bottle for hair, skin, and nails, zinc in there. She had a multivitamin, zinc in there. She had a stress vitamin, zinc in there. And she was just overtaking zinc and very, very minimal copper in there at all. So you have to look at those folks and compare and see what you're getting total for the intake. And if you're in the area and like that, always, give me a call and bring your vitamins in. Let's take a look at them. And just one more quick thing, and I have to tell you this. I did some number crunching on our new 60 serving bag of protein isolate.
Right.
When you compare that 60 servings to, say, buying 3 of our 20 servings, which would give you the 60 servings, and of course, free shipping that we offer, Dr. Lange, this is like half price of what the 3 individual containers would be. Now, this isn't a special price or a BOGO or a this or that or whatever, some kind of deal to get you hooked into this or that. No, that's our everyday price. It's less than $60, $59.99. And for a 60 serving size and free shipping. Yeah. So it works out to half price. And this is, I honestly feel, and I know people would expect me to say this because I help you formulate all these formulas. So, they're like our babies. But this, without a doubt, is the best protein I've ever seen on the market, ever. And at this price and the ingredients, fantastic all the way around.
I agree, Doc. I mean, it's a whey protein isolate, Fortifeye Grass Fed Whey protein isolate. For the price, you can't beat it. Non-denatured American cows, grass fed, build your muscle, lose your fat, and boost your immune system all at the same time. $59.99, free shipping. You can't beat that with a stick. And we're going to run that price for a long time because it's selling like hotcakes. So check it out at fortifeye.com. Remember, your kids can have it. Your great-grandparents can have it. You can use it as a smoothie. You can drink it just raw with water and shake it up in a shaker. You can put it, in a smoothie with different types of fruits. It's just very, very good for you. Somebody asked on the computer right here, can you get too much protein? And, we talked about that last week. I usually say 30 grams of protein at one sitting is about perfect amount. And yes, you can OD on protein. It can cause kidney problems. But typically if you weigh 200 pounds and you're really an athlete, you can take, 200 grams of protein a day. But if you're a regular person, probably the studies indicate half your weight in protein. And if you're in between, take it someplace in between. So anywhere from half gram per body weight to 1 gram per body weight, and you're going to be fine. But 30 grams at one sitting is about all you need. Don't be taking 50 grams at one sitting. You're not going to metabolize that. You're not going to get the benefits of it. It's going to be hard on your digestive system and potentially hard on your kidneys. Let's go to the phones. Mary Ellen in Clearwater. Mary Ellen, good morning. Thanks for holding.
Good morning, Dr. Lange. I was in your office a couple of weeks ago, and I told you that I have a cloud over my right eye, and you asked me if I had cataract surgery, and I did 10 years ago. So I went to the doctor, and he said I have a secondary cataract, and I need to have laser surgery. Yep. Can you tell me what's involved with that?
Yeah, that's called posterior subcapsular haze. And just about everybody gets that anywhere from 6 months to 6 years after cataract surgery. And it's where the bag they take the cataract out of and place the implant in. It's a clear bag after the surgical procedure. It gets cloudy, and it's like a dirty window. They simply take a YAG laser. It's about 5 seconds. It's relatively simple, quick, in-office procedure. They zap it. That opens up that bag. You have to do that once in your lifetime only. It's instant gratification. It's like, wham, bam, thank you, ma'am. And you get great vision.
That would be wonderful. Now, what happens if it happens to the other eye? I'm having a problem even driving now with just this one eye.
It probably will eventually happen to the other eye. Then you just go back to the same ophthalmologist and have that one zapped with the laser as well, and you'll be fine.
And how long is the recovery after that?
Oh, a day. I mean, you can pretty much go do anything you want that day. So there's not much recovery. It's not like cataract surgery. It's really a fairly simple procedure, and you're going to do fabulous.
Thank you. Just one more quick question. I get sick from your one-a-day vitamin. Every time I take it, I throw up. Can you tell me what's doing that?
Well, I would stop taking it, number one, okay? So the Fortifeye Complete Advanced Nutrition has a lot of B complex and C and 8 forms of vitamin E. It's got a lot of things in it: acetyl L-carnitine, alpha-lipoic acid, CoQ10, resveratrol. The list goes on and on and on. And everybody, can't tolerate it. Some people get a little nauseated. But
Oh.
especially if you're on an empty stomach, if you take it with your breakfast, supper, or lunch, your biggest meal, you probably would be okay. But I would say that if you take it with a meal and you still get nausea and throw up, you don't need to ever take it again. And I would probably go to either our organic blue green superfood. That's just whole foods, and you can get all the antioxidants from that, or our Fortifeye Focus. That's just a little liquid gel with lutein, zeaxanthin, and astaxanthin. That's really crucial to have since you've had cataract surgery to help filter out the harmful blue light from damaging your retina. And I haven't had anybody that gets nauseated from that one. So
I take Focus also.
Good.
But what am I going to take for a vitamin if I can't take your one a day?
I would go to the organic blue green superfood.
Okay. All right. Thank you, doctor.
Yep. And if you have some that you haven't opened them, bring them back. And of course, I'll give you your money back. And I'm not going to stick you with anything. Okay.
Yeah, I do have a whole bottle of it, but I get sick every time I take it.
No, you need to stop that. Okay.
Okay. Okay, doctor. Thank you.
All right. Bye-bye, Marianne. All right. Let's see. We've got 1 minute and 48 seconds left. Doc, you still there?
I'm still here. Before we go, I just want to say special thanks to our military and our first responders on this July 4th weekend. We love you. We love America. And we're going to be here next week, and we hope you will too. And so until then, take care of yourself, take care of others, and enjoy your weekend and be safe.
Thanks, Doc. I appreciate that. Doc always has a great way with words. You know that? He's been doing talk radio for as long as I have, so he's no newbie to radio. You know, I've been hosting this show since April of 1993. So remember,
almost going to be 30 years, Dr. Lange, for you. Almost 30 years. We're going to have, you must have started this show when you were 15 or something, to be in there 30 years. I mean, come on. So we're going to have a big celebration when that 30 rolls around. Trust me. We're going to do something big.
Yes, we will. All right. Thanks, everybody, for tuning in. Have a safe and a happy 4th of July. Remember, you can tune in right after the show if you're in the Tampa Bay area on 570 AM, 910 AM, 100.3 FM, 102.1 FM. And then tomorrow and Sunday, you can tune in for us at 11 o'clock in Sarasota on 9:30 AM tomorrow at 11 o'clock in the morning. I want to thank everybody for tuning in and listening to Ask the Doctor. Remember, if you're not happy with the eye care you're getting, get a second opinion. We're certainly available at the Lange Eye Institute for second opinions. Go to our website, fortifeye.com, to learn more about nutrition and anti-aging. I'm out of here. Have a great day. God bless you, and God bless America. Maybe you can hear me now. I see you, John. I remember Romper Room, where the little lady, this is in the 60s and the 70s, the little lady was looking at something and saying, I see Mikey, I see Donna, I see Gina, I see Karen, I see John. Thanks for tuning in, guys. I'll go back and look at all your questions and answer them a little bit later. Bye-bye.